All right, good morning, everyone. Welcome back to this Carsey webinar where Michael and I are going to be discussing our piece, COVID-19 economic crisis by state, and give an update based on the latest state level numbers that were reported for August. So, Michael, just to kind of kick us off here, what did you notice about the August numbers? What's going on with employment in these United States?
Um, Jobs are being gained in almost every state, but what just jumps out at you is that the rate of growth is tailing off. We're still way below. Every state is still significantly below what it was before the COVID crisis hit. Everyone's below where they were in February. But there's one of our charts which you can select any state, and just if you look at the slope of, there's this dramatic drop in employment in from February to March and March to April, and then since then there was a pretty good spike up in May and June, but July and August, it's just the pace of recovery has really tailed off. And I just think the other thing I'd point out is we're also in a separate piece that you're doing, tracking unemployment insurance claims. And even when we were recovering jobs in May and June, and in July and August to a lesser extent, just the number of people being laid off has been at extraordinarily high levels. I mean, many states over what the worst weeks of the Great Recession were, and so even as some people are going back to work, it's a hugely tumultuous labor market because many people are being laid off. And I think what we're seeing is sort of the wave of problems that kind of got set off in August is working its way through the economy. And airlines are doing many more layoffs, a bunch of these places, it just took them a while to do the layoffs as it sort of came into full awareness that this isn't going away quick. And also just the magnitude of it. And also, some, big companies have a hard time laying off people. They have notice requirements and stuff. So you have two phenomena. You have that wave kind of that was launched in May, working its way through the economy, while some parts of the economy are partially coming back. So I think you'll have this restaurant, accommodations, food service, that. I mean, maybe you could comment on that that's been coming back. At the same time, this wave is passing through the economy, but even it isn't well short of all the way back. I mean, is that recall that correctly?
Yeah, I mean that's exactly what we're seeing. I mean, if you look at the leisure and hospitality sector, nationally, obviously that was the sector with the biggest job losses. But you can see if you look at our piece, you'll see the percent changes. We brought back 1.4 million jobs in May in that sector, almost 2 million jobs in June, but then only 600,000 jobs in July and 174,000 in August. So it's really kind of tailing off, and it's not because we're back at where we were pre-recession. We're still down, almost 25%, almost a quarter of jobs in that industry still have not returned. And to your point about unemployment insurance, we're seeing people continually getting laid off. We just hit the 27th straight week of extremely elevated historic levels of unemployment insurance, just initial claims. So these aren't people that are staying on unemployment. These are people filing for the first time, and new claimants are still pouring in every state relative to where they were, and in many states, still at really high levels, even for the last few months of this pandemic.
Yeah, one area that food and accommodations, leisure and hospitality. Food and accommodations is a subcategory of leisure and hospitality, where most of the good portion of the losses occurred. But the retail has actually recovered more strongly than food and accommodations, and I think that reflects a lot. Just that we still see sustained reductions in travel, which really affects the leisure and hospitality. And people are still just very reluctant to sit for an hour in a restaurant, even, and also just there's restrictions on it, but it isn't safe to sit in a bar, a crowd. You're not, people aren't going back to crowded bars, and for good reason. And, whereas retail, once things started to loosen up a little bit, we know more about what's safe to do and what isn't safe to do. So there's more of a comfort level. So we've actually seen retail, it's still, down substantially, but it's recovered a lot more quickly than leisure and hospitality, which is, interesting. The other thing that strikes me is, what's happened to the unemployment rates. I mean, unemployment rate is a little bit of a weird data point these days, because to count in that data as unemployed, it's different than the unemployment insurance stuff. This is like the unemployment rate, and it's based on, you ask people, are you looking for work and are you not working? And the are you looking for work part of that question has been a little weird, because people wanted to work, but they weren't looking for work. And so it's just, and nationally they ask some questions like to get around that, but state by state we don't have any, that it's a little bit of a confounding statistic. But nevertheless, I mean, that being a very high rate says something, because it still shows, of the people who are looking for work, who say they're looking for work, what share are having troubles. And are there states that stand out with that, or?
Yeah, I mean, we definitely see a few. I mean, I think there are 10 states still with an unemployment rate, and as you know, it may be undercounted, with an unemployment rate of over 10%, including some really big states, like California and New York and Pennsylvania. So it's not, both in terms of the number of states with extremely elevated unemployment, but also just the number of people in those states, the magnitude just of people suffering is really high. And so that's stands out, especially in, comparison to pre-COVID, unemployment rates tended to be fairly low in most places prior to this. So to see these elevated levels is, it's definitely still staggering here 6 months after the pandemic started. We really haven't got a handle on, as you know, the public health side of this, which has made the recovery slower. And I think there are a lot of questions moving forward as well, in terms of, with flu season coming, with fall and winter coming, where people tend to be more indoors than outdoors. Is that, are people going to be afraid to come back, and what kinds of economic impacts is that going to have? And then B, if people decide to congregate anyway and the COVID incidence starts to rise again because we're all indoors together, that again is going to have compounding impacts. So there's a lot of uncertainty, and I'm hoping for the best, but there are signs that worry me in looking at some of these.
Yeah, well, we're providing our viewers with a little ray of sunshine, aren't we? So, I mean, I'll pile on, and just one thing to keep in mind is, like, even the job numbers, which, to my mind are disappointing in the last month, just because, again, they've tailed off in the rate of improvement. They're actually they're inflated, because the federal government hired close to 300,000 decennial census workers, which was kind of a one-shot. I mean, they'll still be working next month, but it's a one-shot boost. So, it's not great. I mean, I will say that one of the other things we found is like that there's a pretty close relationship between how well states are doing relative to each other and how hard hit by COVID they are. And, I don't, no state can come back completely without all states coming back or the vast majority of them coming back just because the economy is so interconnected. But I just, it does drive home that we're not going to solve the economic problem until we either solve probably until we solve the public health problem or make progress on it, which just really emphasizes the need to provide, there's talk of stimulus and boosting the economy and getting it going, all of which makes sense, but there's only so much that the economy is going to do better as long as we're dealing with the public health problem. And so it just really, to me, puts a real emphasis on the need to just help people, people who've lost their jobs and people who are, more and more, they're going to tap savings and they're just going to, not have resources to sustain themselves. And so it's really important, I think, to keep that in mind, that people be offered the kind of support they needed during this period. You and I are employed. Like I say, anyone asks how I'm doing, I always say, I'm employed. Me and my family are healthy. And at this point, that's sort of all you can ask. But there are a lot of people who aren't in that situation, and we need to help them out. And the other thing I'll say is, like, there's also if this sustains, there's another path forward other than sort of supporting people forever, which is to think about ways that the economy adjusts to fully employ people without, close contact, right? I mean, what goods and what services can people, who've worked in restaurants provide? It's like, I know people who are wealthier than me for sure, who have personal executive assistants who deal with all the annoying things that all of us deal with in our daily lives, paying bills and all that kind of stuff, and registering warranties, all those little things. And it's like, not that we're going to solve the economy by every waiter who's out of work becoming a personal executive assistant, but there are like things like that you could see where people who had been spending a certain amount and going out to restaurants now start, spending money on people who provide that service instead, right? So you could also see the economy starting to, as market economies do, which is the great thing about market economies, is they kind of adjust to big changes in circumstances. And you could start seeing some shifting like that, even if this does sustain, which might offer some kind of economic recovery too.
Yeah, that makes a lot of sense. People need to work, and people will still have a need for services. And so, to the extent, we're all here on Zoom, and, none of us were really talking about Zoom 6 months ago. And, and now it's a big, certainly part of our everyday lives. We're using it constantly. So, can definitely see and hope, that to the extent that the public health response can't be fixed, that, people are still able to be employed.
Yeah. And these transitions are hard, but they happen, right? If you have a pool of workers who want to work and a pool of people with the means to pay for things they want, it to some extent, not with perfect equity or anything, but it sorts itself out on the macro scale over time, typically. So, that's, hopefully we'll get past the health crisis and be able to go to bars and restaurants instead. So we'll see. I don't think I have any other big points to make out of this. I encourage people to go to the website. There's a lot more detail, and you can sort of dig in yourself, and very interactive, so you can look at your state and look at it from different ways and different measures, specific industries, and all of that. So I encourage you to play with it. Um, uh, Anything else you have to add, Jordan?
No, I would second that. I think really the way that we've laid this out is, we give some examples in the piece, but we try to lay out the data in a way that makes it accessible and, dare I say, maybe even fun. I mean, obviously the findings are a little grim, but in terms of the being able to play and answer whatever questions you're looking to answer, I think our piece has some utility in that. So I just second that.
Yeah. Fun for a certain kind of person.
Yes. I mean, if you're the person watching this webinar about data and you're interested in digging in a little more, encourage you to do that.
Yeah, and please contact us if you have any suggestions or comments. All right, thank you.
Thanks, everybody.
Bye.